Hello viewers, right now we are at High-Tech today for Medical Hospital Needs Expo. Medical is India's largest B2B medical equipment exhibition is organized by MedExperts Business Private Limited, promoted by Dr. Manivanan S., Managing Director of Kaveri Hospital, a 2000-bedded hospital group in South India. Come let's go inside and see. CVR English, why you are here for this expo and please explain about your product.
I am Nagesh from Process Care Systems. So we specialize in manufacturing nurse call system for inpatients and also queue management system for outpatients. Okay, we are in this exhibition to not only to promote our products, and also to know what better features the doctors or hospitals so look for in our products. So we basically happen to be the designers. So we keep developing products based on the requirements uh, posed by the hospitals. And similarly, they also may suggest some of the features which are not existing in our products, and they may wish to add those features also. So that's why we are here to collect that feedback from various customers. Not only promote, like I said, not only promoting our product, also to get a feedback about our products. And yes, okay, so we would like to get some business also out of this exhibition. And we have been participating in this exhibition year after year and across the country. And these organizers, okay, arrange for these exhibitions across the country, whether it is Mumbai, Delhi, Hyderabad, Bangalore, and other places also, Chennai and other places. So we participate in all these events, and this is one such event, okay, where we are participating.
Please explain about your product, sir.
See, this is our nurse call system. Okay, this nurse call system has got several modules. So one of the modules is deployed in the nursing station. So this nurse call system is basically a system which allows the patients to notify to the nursing station that they want some help. Okay, so to notify to the nursing station, we have something called bed calling unit. So this is the bed calling unit. So from the bed calling unit, they can trigger a call. So for triggering a call, all that they have to do is press this button, so call button. Okay, the call button can be pressed either by the from the prompt switch or from the bedded panel itself. Okay, so the moment they press this button, okay, so you can see the door indicator also will be flashing in amber. Okay, and also the status indicator is flashing in amber, and at the same time it is also getting notified at the nurse station. So nurse station need to show which room needs some help. Now if the nurse is available in the nursing station, she will say, yes, I have seen this call. Now right now, okay, it is also announcing attention patient call, and also it is flashing in amber. Okay, now if the nurse says, I have seen this call, so then the voice gets suppressed, the flashing window becomes steady. At the same time, there the status indicator also becomes steady. So here it is indicating to the patient somebody has seen your call and help is on the way. Okay, similarly, okay, the nurse also has seen already this kind of a call. Now she is expected to walk into the room. So and also while walking down the corridor, she can also find out which room has called. She doesn't have to memorize which room has called. She can directly walk into the room by looking at the corridor display. This also we refer to it as corridor display, which is placed just above the door facing the corridor, so that she doesn't have to memorize which patient has called. So she can walk into the room directly and she can say, I am taking care of this. The moment she says, I am taking care of this, this door indicator will turn green so that another nurse need not walk into that room. At the same time, it also gets communicated to the nursing station saying, so there is a nursing taking place. Now, the nurse has got 2-3 options. One is to clear the call. So if she clears the call, call gets cleared and also it is removed from the display. Yet another sequence is a call is made. Okay, it is flashing in amber. Okay, now she is walking down the corridor. Now, in that case, she doesn't have to go to the nursing station. She can directly walk into the room and she can say, so I am taking care of this. The moment she says, I am taking care of this, again it will turn green. It also gets indicated at the nursing station. One nurse has walked in directly, okay, so into the room. So another nurse need not come here. Okay, now she can ask for extra help in case she cannot address the call on her own. So she can ask for additional help by giving a long press on this. Okay, so long press only can trigger this so that inadvertent calls triggered by the patient can be avoided. Okay, now it says there is an extra help that is required. So extra help required is also indicated in terms of the red indicator flashing here. Okay, now she can again clear the call after extra help has arrived. Yet another sequence is she made a call, the patient has made a call and she walked in also, and there seems to be a code blue situation. Okay, this code blue situation also can be triggered by giving a long pulse. So then, okay, so code blue gets broadcasted to all other nursing stations also. Okay, not only in this nursing station, and you can hear, okay, everywhere it is howling. It is code blue situation. That is to alert the entire staff, okay, and bring them here to this patient so that they can revive the patient. So that kind of a thing it is. Then they can also clear this. So this kind of a thing is what is our nurse call system. Okay.
Wow, very interesting, sir. So, how are you feeling about this expo in Hyderabad?
We have been getting good inquiries and relevant people are walking in, luckily for us. Okay, and also I think there is good potential here, and healthcare segment also is growing every day. So and we got pretty good inquiries. So maybe it turns out to be some good business for us.
From how long you are doing this business, sir?
Although my company is about 35 years old, I got into this line of activity since 25 years. Okay, so in the beginning, okay, so we had very simple system. Like I was mentioning you, so we keep on participating in such exhibitions and keep on getting feedback from the customers. So then we kept on adding various features. That is how it evolved into this kind of a system. Earlier we had very simple system. So later on we started adding these features. And these are all the basic functionalities that I have explained. Apart from this, we also have advanced features like call escalation. Just in case this call is acknowledged and is forgotten to be attended, then in that case you can have different time thresholds. Okay, if that time threshold has been elapsed, then automatically it will dial up some mobile numbers. Those numbers can be stored in the system, and that also can be categorized into 3 different groups. Different levels of time thresholds can be tuned into the system. If that time threshold has crossed, it will dial up those numbers automatically and send an SMS. So these kind of features are added. Apart from this, we also have some feature called call forwarding. There can be many nurse stations in a healthcare center. Okay, not all the nurse stations will be active all the time. Some of the nursing stations will be either lean staffed or they are shut down. So in such cases, the calls landing up at the shutdown nursing station should be automatically forwarded to the active nursing stations. Those things can be programmed into the system, like from which time to which time the calls landing up for this nurse station should be forwarded to another nursing station. All these nursing stations also can be named. Those names also can be tuned into the system. So that kind of features also we have added.
Thank you, sir. Thank you so much. Hello viewers, right now we are with the Oxford Gas Systems India Private Limited manager with us, Balaji Chivukula sir. Hello sir,
Hi.
why are you here for this expo and explain about your product?
Why are we here? The reason is I think we are one of the oxygen generating plant companies in India, and we already have installed around 340 plants across the globe, out of which 235 are in India and the balance in abroad. And the strength of our company is not even one single plant has ever got a complaint. Even if there is, the downtime is as less as 2 hours, and we take care of it. That being our strength, and this being a medical exhibition, and this is a primary requirement for any upcoming or existing hospitals. So that's the reason we are here. And another valid reason for this year in our stall is we have a new baby, new invention which has been created. This can be used by any clinic of 15 bedded, 20 bedded, 25 bedded clinic also to support their oxygen systems, to support the oxygen requirements. This particular plant, what you can see, can support you up to 5 cylinders a day. Okay, it can support one ventilator. Okay, now in terms of the cost of the cylinder, there's a lot of variation. Some sell it for 300, some sell it for 350. Sometimes because of the natural calamities or political situations, the supply of cylinders might not come. Okay, so that is when this particular plant, which is installed in the premises of the hospital, at the switch of a button, okay, this can produce the required oxygen with the required purity, and the patients are always safe. So since 2017, we have around 340 installations done across the globe, and till date, no complaints. That's the beauty about Oxair.
Wow, that's great sir. From how long you are doing this?
Yeah, 2017, I said. Since 2017, we have installed around 340 plants across the globe. Not only in India, but even abroad. We have 60 approximately in Philippines. We have done it in South Africa, Togo, Ghana, Malaysia, and we have certain Eastern, Southeast Asian countries also. And even in Sri Lanka, we have a plant. Even Nepal, we have a plant. That's our strength.
So how are you feeling about this expo in Hyderabad?
It's a good one. And Hyderabad is one of the main cities. And other than the 4 metros, Hyderabad is also considered as good as a metro now. There are a lot of upcoming hospitals in Hyderabad. And we already have 9 good installations in Hyderabad. And last year, the show Medical exhibition on 17th, 18th of 19th of March 2023, we already closed 4 orders from that. Okay, and we are yet to close some more orders because the hospitals are under construction. So this year we'll have to see, and we've got around good leads today. And after the third day, we will evaluate and see how many we can close. And this being the new baby, this is as good as it is required by every nook and corner hospital or a clinic in the country.
Okay sir.
Nobody has this. Nobody can challenge our technicality. Nobody can challenge our service support. That's for sure.
Anything else to add sir?
That's it. Buy one plant.
How much it costs sir?
This one, approximately you can say around including GST around 9.5 lakhs. Okay, and you can once you when compared to a cylinder-based hospital structure, if you use this plant, you can save a minimum of 45 to 50% savings in your current expenses. You can save 45 to 50% for sure. While providing a quotation, if the doctor asks us how good is this in terms of return of investment, we can give you all the figures in writing. We don't hesitate because it's in black and white, and we'll prove it to you. Okay, post which the doctor is confirmed because he knows his electrical consumption, he knows his current gas procurement bills. Okay, compared to that, we know what is the kilowatt of this compressor and what is the cost of electricity. We will do the calculation. I'll show it to him, and clearly he can see a 45 to 50% of savings in his expenses.
Hello, sir. We are from CVR English. Why are you here for this expo in high techs and explain about your product?
We are here to promote our product. We are the manufacturers of DVT sleeves and DVT pump. So this is the first ever DVT pump in India. So what DVT system does is it prevents blood clots in bedridden patients.
Explain about your product, sir.
Sorry.
Yeah. How it will works.
So it works by the principle of pneumatic compression. So the sleeves are wrapped around the legs and they provide pneumatic compression, and that's how they take care of blood clots. So blood clots are formed when ICU patients are immobile, and that time they need external pumping for blood stimulation. So for that, this product is used.
From how long you are doing this?
We have been manufacturing for 5 years, since 2018, so it's 6 years.
How are you feeling about this expo, medical expo?
The expo is really good. The response is really good. Initially, I think Chennai Expo was the main expo, but nowadays even Hyderabad Medical has been getting good number of
Ravi Prasad, sir, founder of Omega MedSurge. Hello, sir. Why are you here for this expo and please explain about your company?
So every year we participate here from Omega MedSurge. So there is one medical expo and also like Med Expo. There are two things happens every year at High Tech's Exhibition Center. This is a place under one roof. Many companies will participate of different products which are meant for small hospital to a big multi-specialty hospital. So this is under one roof. Many people who are entrepreneurs and who wanted to start their own new hospital setup, they come to physically see the equipment. Sometimes they interact with the product specialists and take a decision because they'll have a lot many options to choose. So we cater different companies like we are authorized channel partners for Viproji Healthcare, Johnson and Johnson, Smith and Nephew, Merrill, and Map Industries. So we have every product, the product you name that we can provide you, starting from ECG to CT scan, and we have got operation theater tables, lights, anesthesia workstations, monitors, ventilators for adults and ventilators for neonates. A lot many products. You name the product, we can give you. And also we sometimes new entrepreneurs will come with a lot of doubts and confusion whether to choose this product or that product. We definitely give them a proper guidance, and sometimes we advise them. Okay.
So, how are you feeling about this expo?
This expo is always a good to say that we are definitely there in the field to show that that's what we come here to showcase our products. So seeing is believing. So people come here and physically see the product, touch the product, and they operate as like monitors. We have lot many features. So when we explain, they'll not be able to know what exactly. When they come here, they physically see and try different modes, and they will understand. Yeah, many of them they don't know like how many features our product have got. When we explain them, they really feel very comfortable, and which will help them to analyze and give a better care to their patients.
So how long you are doing, sir?
This is 8th year of our company. It's founded in 2015. Since then, we are participating in medical expos and providing a lot of information to people, and also like people, those who come here, when they interact with us, that builds up some relationship and trust. With that, that will get converted into orders for us.
Very nice to know,
Thank you,
sir.
thank
And
you.
anything else to add?
It is good because a lot many people come, and somebody wanted to start their own businesses, like small distributors will come. So we guide them also what products to take, and we support them giving some knowledge and supporting with them some small products to big products. Okay, this is a win-win situation and helpful to many of the new entrepreneurs in the hospital side and also for the business. Thank you.
Thank you so much, sir.
So which is mainly used to sterilize hospital linen and instrumentation which are used in the operation theatre for a patient safety. So we have got a different product line. We have got these things are technically very high end, which are helping hospital to maintain sterility, because most of the time if anything is not properly sterile, so that will cause infection to patient. In turn, patient has to suffer and lot many antibiotics, and hospital stay also will increase. So using as good products will help the hospital also, and also the patient stay in the hospital will be shortened and recovery will be faster. So this is one model, and we have one more model. And nowadays people are using ETO sterilizers. ETO sterilizers are like ethylene oxide sterilizers. Normally metallic things we can do autoclave, and that will take 120 degrees to 135 degrees Celsius heat. Whereas these things will, with the ETO, ethylene oxide, with that we sterilize and plastic, and which will melt in the heat. So those things we sterilize here. These are the products. Yeah. That's what, as I explained to you, I have complete range of products. From to start a complete, we can hand over a turnkey project, giving you every product which is required for a hospital.
Thank you so much, sir. How are you feeling about this expo here in Hyderabad?
Exhibition is quite good. There are multiple customers we are having at our end. Few distributors also connected us, And also, as I told you, that we are having the India's fastest SB meter. So there are multiple queries we are having. And here also you can see that people are here for multimeters as well. Actually, we are Miko Biomed Group. It is in Korean group, so it is into the industry from last many years. But yeah, in India, they have started their manufacturing unit this year only. So right now we are having approvals for these two products. This one is VeriQ HB Mate, and that one is VeriQ Multi. And soon we will getting other product also.